Ever pondered the significance of a smear test? What if we told you that this simple procedure could potentially save your life? Yes, indeed. A smear test, also known as a pap test, is a crucial medical examination that can detect abnormal cells in the cervix, which could indicate cervical cancer. Now, the thought of a smear test might seem daunting, but the process itself is quite straightforward. So let's demystify it, shall we? The first step starts at your doctor's office or clinic, where you'll be asked about your medical history. This involves discussing any past smear tests, surgeries, or pregnancies. It's important to be open and honest during this conversation to ensure the most accurate results. Next, you'll undress from the waist down in a private area, and will be provided with a paper sheet to cover yourself. Once you're ready, you'll lie down on an examination table with your knees bent and your feet resting in supports called stirrups. The healthcare provider will then gently insert a medical tool known as a speculum into your vagina. This allows them to see your cervix. While the speculum might feel a bit cold and slightly uncomfortable, rest assured it shouldn't cause pain. Following this, a small brush or spatula is used to gently collect cells from your cervix. This is the actual smear test. You might feel a slight discomfort, similar to a period cramp, but it's usually over within a few seconds. These collected cells are then placed on a glass slide or in a bottle of liquid and sent to a laboratory for examination. The lab will analyze the sample to check for any abnormalities that could indicate a risk of cervical cancer. The entire procedure typically takes less than 10 minutes, and the results are usually available within 2 weeks. It's important to remember that a smear test isn't a test for cancer, but a test to prevent it. Most results come back normal, and even if abnormal cells are found, it doesn't necessarily mean you have cancer. It simply means you might need further testing or treatment to prevent cancer from developing. So, there you have it, a simple, quick, and potentially life-saving procedure. Now, it's your turn to take action. If you're a woman aged 25 to 64, and you haven't had a smear test in the last 3 years, it's time to schedule an appointment. Don't let fear or discomfort deter you. Remember, early detection is the best protection against cervical cancer. So take that bold step today. Your future self will thank you.